Hi all, I am Nirupama. I will discuss Module 2 with you, which is on the physiology of breastfeeding. Your learning objectives will be as follows. We will discuss where and how is milk produced in the lactating mother, the three stages of lactation, neurohormonal control of how milk is produced, secreted, and delivered to the baby. What are the oral reflexes in the newborn that helps in breastfeeding? And eventually, what happens when the mother stops breastfeeding? So the lactating mammary gland, we'll just discuss about the functional anatomy where the fundamental secretory unit is the alveolar epithelial cells. These cells are surrounded by the myoepithelial cells which contract, releasing milk from these alveolar epithelial cells. We will discuss this more in detail as we go through the slides. In the pregnant mother, estrogen, progesterone, and prolactin help in the development of the mammary gland, wherein the glandular tissue increases, that is, which produces milk, increases in comparison to the fat tissue, which is roughly 2:1 times in a lactating mother compared to 1:2 times in a non-lactating breast. As you see here, fat tissue surrounds the secretory lobules, which look like a bunch of grapes here. And in each secretory lobule, there are multiple alveoli. And when you take a cross section of this alveoli, you see that it's lined by the secretory epithelium, the alveolar cells, which are surrounded by the myoepithelial cells. The milk is secreted into this space, which then drains into the duct. Let us now understand how these cells produce milk. There are 4 transcellular pathways and there is 1 paracellular pathway. So if this is our cell lining the alveolus, you have a basal side, it's called the basement membrane, and you have a apical side of the membrane. Now the basement membrane faces the maternal capillaries and the myoepithelium, and the apical membrane faces the lumen. To start with, the first pathway, the secretory pathway, wherein you have the cell machinery producing the milk proteins, which are encapsulated into a vesicle, and they are transported to the apical membrane, where they integrate with the membrane and the proteins are released into the lumen. So that is the first pathway, the secretory pathway. Second is the transcellular pathway, wherein you have the proteins such as immunoglobulins, which are coming from the mother, and they are transferred all the way again to the apical membrane, where again they integrate and are released into the lumen. So this process is called exocytosis. So that is pathway 2. It is the transcellular endocytosis with exocytosis. Then the third pathway, which is the lipid pathway. In the lipid pathway, where is the fat coming from? So the fat is either synthesized in the cellular machinery, or they are coming from the maternal diet or from the fat stores of the mother. Again, they form lipid droplets. They move towards the apical membrane, wherein these droplets, as you see here, they pinch off with the membrane surrounding them. So they pinch off. Here you see a milk lipid droplet in the milk. So that is pathway 3, the lipid pathway. And then you have pathway 4, which is the transcellular pathway for salt and water transport. Now, this is happening through transporters that are present in the basal membrane and in the apical membrane. So, the salt and water are taken from the basal membrane, and through channels they are secreted into the lumen. So that is pathway 4. So it's transcellular salt and water transport. So those are the 4 major transcellular pathways. And then you have the paracellular pathway, wherein you have movement of ions and water and leukocytes. So there are even cells that are coming in through this pathway, which traverse between two cells. So this is called the paracellular pathway, that is in between two cells. They just traverse and they come out into the luminal side. So as you see in this pathway. So these are the 5 pathways which help in synthesizing the constituents of the milk and releasing them into the alveolar lumen. So the composition of the milk reflects the highly coordinated functioning of these pathways, and their composition is very variable. It could be there's variability within the day or between days, between individuals and within an individual at different time points. And these depend on maternal factors like nutrient stores and the maternal diet, and also the delivery timing as to when the mother has delivered, at what gestation, and the time from the time she has delivered, that is time postpartum. And neonatal factors such as the suckling, the removal of milk from the maternal breast, how much of milk is removed, and also individual neonatal needs. So it is specific to the neonate. So this shows the importance of mother's own milk for her offspring. Okay, here we see the nipple areolar complex. 1 is for the nipple, 2 is for the areola, and 3 is the Montgomery tubercles. The areola becomes darkly pigmented during lactation, and this may act as a visual cue or signal to the newborn. So they will close their mouth on the areola and the nipple together and not just the nipple. This to obtain milk from the nipple areolar complex. The Montgomery tubercles, on the other hand, secrete a lubricant which helps to protect the nipple and the areola. Coming to the stages of lactation, there are 3 stages of lactation that are identified, which are now renamed with the mechanism that occurs in each stage. So stage 1 is called secretory differentiation or lactogenesis. Stage 2 is called secretory activation. Stage 3 is called lactation or full milk secretion, and we will discuss each one separately in the coming slides. So secretory differentiation or stage 1, it's a stage of pregnancy wherein the mammary epithelial cells differentiate into lactocytes, that are milk producing cells, and their capacity to synthesize unique milk constituents. This requires a hormone complex, usually is estrogen, progesterone, and prolactin, and it does not depend on the suckling by the infant. And the period begins around mid-pregnancy, around 16 weeks of pregnancy, and should the mother deliver, milk would be produced. This is colostrum. So, as the pregnancy proceeds, milk production is inhibited by high levels of circulating progesterone and estrogen. So, this stage can be identified by measuring the maternal levels of plasma lactose and alpha lactalbumin. Next, we go to stage 2. This stage is triggered at birth with the withdrawal of progesterone. You see the progesterone levels dropping and the delivery of the placenta with subsequent rise in lactose in the breast milk. And this is the stage of initiation of copious milk secretion activated by the hormones prolactin, insulin, and cortisol. And a period is anywhere between 30 to 40 hours after delivery to 4 days. Here, the composition of milk changes, and there are alterations that are happening in the cellular pathways that we discussed. And the maintenance of this stage is by frequent milk removal. Again, stressing on the importance of regular breastfeeding and effective suckling by the infant to maintain this stage. So, in this stage, the changes that occur in milk composition include a drop in sodium and chloride, and there is also protein drop, and increase in the lactose with increase in the volume of milk. So in the next 10 days, the composition of milk changes to a more mature milk, and this changes continue to happen. You see the colostrum changes to transitional milk to mature milk, and the composition of colostrum wherein you have high protein and human milk oligosaccharides goes towards a more mature milk composition of a higher fat, lesser protein, and more of lactose. So by measuring the concentration of these constituents in breast milk, you can identify this transition in the stage. The milk volume also increases during this stage. You see that the milk volume is going anywhere from 0 to around 600 milliliters per day around the 4th day postpartum. So one should suspect if by the 4th day postpartum the milk is not anywhere close to 600 milliliters per day, consider there's a delay in secretory activation and provide additional lactation support. So what are the risk factors for delay in secretory activation? So usually preemie mothers, first-time mothers, obesity in mothers, maternal diabetes, and mostly type 1 diabetes is more of a risk factor. The cesarean section, stressful vaginal birth with a prolonged stage 2, retained placental bits, hypoplasia or insufficient breast tissue, polycystic ovarian syndrome in the mother, or infertility, or thyroid dysfunction, and stress. So all these factors that impair mechanisms of milk production, either anatomical or hormonal, we have discussed so far are risk factors for delay in secretory activation. So identify these factors, and again, provision of additional lactation support is essential here. Stage 3, also called lactation, it's maintenance of this established milk secretion. It's also called galactopoiesis. And the key hormones here are prolactin, insulin, and hydrocortisone. So here the mother's metabolism is increasing. So there's also an increased requirement for nutrients in the mother. And this is again the stage maintained by frequent milk removal from the baby. So it's important to ensure regular breastfeeding and effective suckling to maintain stage 3 or lactation. Next, we move on to neuroendocrine control. I know this figure looks complex, but let me break it down to you. So once the baby starts suckling at the breast, you have a signal that goes from the breast through the spinal cord to the hypothalamus in the brain. So here you see there are green and red marks which are positive and negative actions. So when the signal comes in through the spinal cord, there is a negative or inhibitory action on the nucleus which produces dopamine. Now, dopamine inhibits the release of prolactin. So, once you inhibit dopamine, prolactin is released, and this prolactin acts on the breast to help with milk production. Now, second action is these again the neurons coming from the spinal cord, they act on positively on the two nuclei which produce oxytocin. So oxytocin is required for the secretion of the milk, that is the rejection of milk from the breast, and that is again released with the positive action on these nuclei to release oxytocin into the bloodstream, which goes again and acts on the breast to eject milk for the baby. Next, you also have another action wherein you have inhibition of the nuclei which secrete the hormone which is called the gonadotrophic releasing hormone, and this hormone helps in maintaining an ovulatory stage, or it helps in uh, in causing amenorrhea, so that there is amenorrhea at least for the time period the mother is breastfeeding. So this inhibits the ovarian cycle. So there are three actions. One is release of prolactin, which acts in and helps in production of breast milk. Next, there is release of oxytocin, which helps in the release of breast milk. And third, there is decrease in the gonadotrophic releasing hormone, which helps to inhibit the ovarian cycle. So there are three actions. So as you see that you have the dopamine receptor antagonist. So you see commonly in the postnatal ward, we sometimes prescribe mothers with domperidone, which is a dopamine receptor antagonist. So this helps in increasing the prolactin secretion and thus the milk production. Another important point is there is also an increase in insulin which stimulates synthesis of the protein, that is milk protein casein and lactalbumin, and also milk production. So it is beneficial to breastfeed after a meal. So you tell mothers to eat preferably before they breastfeed. So suckling by the baby causes an episodic increase in prolactin, and this release is over and above what is the normal increased baseline in prolactin. And there you see the increase. So breast pumping causes similar increase in prolactin like suckling, and there is a circadian rhythm. What does that mean? So the prolactin is more in the night than in the day. So it's preferable to feed more in the night. And if direct breastfeeding is delayed, you should ensure milk is removed by either manual expression or preferably by breast pumps to and encourage mothers to breastfeed in the night. Next, we'll talk about how this milk volume is controlled. So you can see there's a production of a substance called feedback inhibitor of lactation, and this accumulates or increases as milk is accumulating in the breast. It's a reversible phenomenon wherein as the milk is removed from the breast, the FIL reduces. It is concentration dependent, so more the FIL, more the inhibition of milk production, and it affects mainly the volume, that is the secretion of milk, and not the composition of milk. So again, it's important to ensure regular emptying of breast milk to prevent accumulation of FIL. So in summary, what are the factors which enhance breast milk production? Definitely, as we saw, we need to regularly empty the breast, that is by sucking of the infant or by expression of milk through breast pumps or manual expression, and preferably night feeds. And what are the factors that hinder this? So, of course, if the baby is bottle feeding, or if there's an incorrect position which is not allowing for adequate removal of milk from the breast, and if the mother has a painful breast. So these are the hindering factors. So next we did see how oxytocin is released in the neuroreflex. So here the stimulated oxytocin causes contraction of the myoepithelial cells, which releases the milk, which is called the let down reflex. So there's a release of pre-existing milk within 40 to 60 seconds of suckling from the baby. So what are the factors that increases milk production through this increase in oxytocin? Nipple stimulation, the sight, smell and touch of the baby, breast massage, back massage to relax the mother, and positive emotions in the mother. And opposite of these factors will decrease oxytocin, decrease milk, such as fear, worry, anger, stress, physical exertion, pain, cold, and alcohol. So these first few factors, they increase the sympathetic activity, which causes vasoconstriction, and that reduces the oxytocin supply to the breast. And consuming alcohol has a direct action on the center, inhibits oxytocin release. So it's important for supporting the mother in breastfeeding. There should be family support as well as support of other uh, health workers and community members in helping the mother breastfeed. So there are some signs and sensations for this active reflex, oxytocin reflex, and the mother may notice like squeezing or tingling sensation in her breast just before or during a feed, the milk flowing from her breast when she thinks of her baby or hears crying. So milk is dripping from other breast when the baby is suckling on one breast, and there could be painful uterine contraction, since you know that oxytocin also acts on the uterus to help it contract during feeds, usually in the first week. And you can also hear deep slow sucks and swallowing by the baby if the breast milk is flowing into the baby's mouth. So those here we are discussing a few reflexes that help in breastfeeding, which are infant reflexes. So I have given some helpful videos in the educative material in module 2. Please go and see those videos, and this will help you understand how do you identify these rooting, sucking, swallowing, and tongue thrust reflex. So the rooting reflex is when the baby searches for the breast, when the cheek of the baby is stroked and the baby opens its mouth wide open to search for the breast. And once the baby is search for the breast, it holds on to the nipple areolar complex and starts suckling, which is followed by swallowing of the breast milk. The tongue thrust reflex is when the baby thrusts the tongue out to grasp the nipple areolar complex, and this is very important, as you will see in the next slide. For the peristaltic action of the tongue to extract the milk from the breast. So all these reflexes They disappear around 5 to 6 months, helping the baby transition better to complementary foods. So, like I said, I have shared the link to YouTube videos on the module education material, and these reflexes will also be demonstrated bedside during practical sessions. So here you see the video how the baby's tongue goes into a peristaltic motion to express the milk from the nipple areolar complex before it swallows. So the coordination of the suck and swallow and breathing is very important, and the number of sucks they vary depending on the milk ejection flow production and the individual infant's ability. Usually babies swallow at end expiration once they're at the end of expiration, and preterm infants usually swallow mid inhalation, so that there's a risk of decreasing saturation and decreasing heart rate or aspiration in these babies. Also, as we saw in the reflex arc, that sucking inhibits ovarian cycle, so breastfeeding delays ovulation, but with continued nursing, ovulatory cycles will eventually resume. So what we learn here is extra care should be practiced while feeding preterm babies, as their reflexes are still immature and you allow them to mature over a period of time. So finally, when milk is not removed from the breast, the glands start distending and the production over a period of time ceases. So this is what the process is called involution, where there is, once you have stopped weaning or stopped breastfeeding, or where the apoptosis, that is cell death, occurs of the secretory epithelium. So this is because of lack of stimulation, plus there's engorgement of the breast, and this will reduce the blood flow, which in turn reduces oxytocin and its activity on the myoepithelium. And around 40 days where the breast takes completely to involute. So if somebody is looking for relactation, preferably do it within 1.5 months. And the gland does not return completely to the pre-pregnancy state, which means there are still prolactin receptors that are present, and this helps in early secretory activation in the second pregnancy. So that's a beneficial factor. So to summarize, breastfeeding is a demand supply mechanism. So regular emptying of the breast means as you remove more milk from the breast, more milk is produced, and this is crucial for continued milk production. And one should anticipate risks for delayed secretory activation wherever there is need for additional support. And most importantly, psychological support is an essential component, considering the factors of stress, fear, and anxiety which can impact the breast milk production. And with this, I end the physiology of breastfeeding session. Thank you.